I am a chain smoker. Before NICOTEX, I have chain smoker.
NICOTEX Nicotine Gum. Important instructions. How to chew NICOTEX gum. The methods of chewing the gum is not the same as that of an ordinary chewing gum. Use the following steps to ensure maximum benefit from the gum. Step 1. Chew it slowly till you get the taste of nicotine. Step 2. Place and rest between cheek and gum. Step 3. When the taste fades, repeat step 1. What is NICOTEX? NICOTEX is a gum containing nicotine that helps people who smoke or chew tobacco and gutka quit the habit. It works on the proven principle of nicotine replacement therapy, NRT. NICOTEX does not contain tar and other harmful chemicals which are present in cigarettes, tobacco and gutka. What is nicotine? Nicotine is a chemical present in tobacco leaves. When you smoke or chew tobacco, nicotine enters the blood and goes to the brain. It activates the part of your brain which produces a feeling of pleasures and happiness. After some time, as the nicotine level drops, the feel-good effect reduces and your body starts craving for the next cigarette or tobacco. Thus, you get addicted to smoking cigarettes or chewing tobacco. How does NICOTEX work? Each piece of NICOTEX provides of nicotine that you normally get from cigarettes or chewing tobacco. The level of nicotine is lower than that in cigarettes or chewing tobacco. NICOTEX allows your body to gradually adjust to having less nicotine until you no longer need any, and thus helps you quit smoking or chewing tobacco. What is the indications for the use of NICOTEX? To reduce withdrawal symptoms including nicotine, craving associated with quitting smoking or chewing tobacco and gutka containing tobacco. Which is the right strength for you? NICOTEX is available in two strengths, 2 mg and 4 mg. 2 mg is appropriate for those who smoke 20 cigarettes a day or less. 4 mg is appropriate for those who smoke more than 20 cigarettes a day. What is the dosage and administrations? 4 mg as advised by the doctor and 2 mg consumed a gum whenever you get an urge to smoke. Over a 12-week period, NICOTEX allows your body to gradually adjust to have less nicotine. Below dosage schedules is recommended. Weeks 1 to 6, take 1 gum every 1 to 2 hours. Week 7 to 9, take 1 gum every 2 to 4 hours. Week 10 to 12, take 1 gum every 4 to 8 hours. Do not exceed more than 24 gums per day. Reduce 1 gum per week. Recommended therapy is for 12 weeks. Note: do not eat or drink or use removable denatures with the gum in the mouth. Avoid having any drinks for 15 minutes before the gum is used. The side effects which might be seen with NICOTEX will be the same as nicotine given by any one other routes. These side effects are usually thus dependent and may not be experienced by all. Common side effects such as headache, nausea, hiccups, stomach discomfort, sore mouth or throat and jaw muscles ache and sleep disturbance may be seen particularly during the first few weeks. Consult the doctor. If you are taking any other medicines, especially those containing theophylline, terpene, clopines, roniplines, non-nicotine drugs to stop smoking. If you have had previous reactions to gum or other nicotine-containing products. If you experience anything is that unusual after the use of NICOTEX. Next, if you have other medical conditions like uncontrolled high blood pressure, stroke, stomatuclear, kidney or liver disease, heart or circular problem, diabetics, allergic reactions, severe sore throat, inflammations of mouth, overactive thyroids, irritable bowel syndromes or adrenal gland cancers. Next, if you are pregnant or breastfeeding on sodium restricted diet or need to use the gum for more than 12 weeks. NICOTEX overdose. If you have used more gums than recommended on in case in a child has chewed or swallowed some, then contact a doctor immediately. The general symptoms of nicotine overdose include headache, sickness, diarrhea and stomach pain. Do not use NICOTEX gum if you are below 18 years of age, if you are non-user of tobacco. Storage. Store in cool, dry place. Protect from direct heat and sunlight. Keep out of reach of children. Don't use after expiry date mentions on the box.